I'm Dr. Fred Ferlic, Chief Medical Officer of TayCo External Ankle Brace. I'm passionate about new technology and I'm passionate about TayCo because I think it's the way to return patients functionally to their care. It will be a game changer for your practice and a life changer for your patients. It's going to get your patients back to functionality. I'd like to give you a short background of my medical career. I graduated from the University of Notre Dame, graduated from Cornell University Medical School and University of Minnesota Orthopedic Department. I was in private practice for over 40 years, and I treated a lot of the Notre Dame teams. I learned a lot about ankle and hindfoot problems, to which this brace applies, because that's the #1 problem in college sports, as you know. I'm going to go on next to what is TayCo External Ankle Brace. It's the only external, in other words, it fits over your shoe, brace or AFO. It's a 3-for-1 brace. It has 3 different settings, which is very important for the continuum of care. You can either lock it completely at 90 degrees like a cast or a walking boot. You can have limited early range of motion, let's say 5 dorsiflexion, 10 plantar flexion. And then you can have full range of motion in dorsiflexion, plantar flexion. Now, this is important because if you have a fracture of the lateral malleolus non-displaced, okay, or a stage 1 Charcot or whatever, you may want to completely immobilize the ankle or hind foot. And then you may want to go on to limited range of motion after 5 or 6 weeks for a fracture or after Charcot, whatever your designated plan is. And then you may want to go on to limited range of motion and then full range of motion in dorsiflexion, plantar flexion. It's not only an external brace with 3 different settings, so it's a 3-for-1 brace, but it also is a stability and a balance brace because it prevents inversion and eversion. By preventing those two, you prevent the edge of the shoe from catching. So that's why it's a stability brace and why it's a balance brace. And I'd just like to point out some features of the brace in that this is the TayCo External Ankle Brace on a shoe, on a regular jogging shoe, and also one on a steel-toed work boot. So the advantage of it is, as I said before, it has a 3-for-1 setting on the hinge, so you can just remove the bar, and then it's full range of motion. Okay, I'll remove this other bar. So you have full range of motion, or you can have limited range of motion by putting the bar in the bottom, or you can have full range of motion by putting the bar in the top and just slide in the bar. So it's got all 3 settings. And another feature of this is that it has an adjustable strap on the bottom. And the reason that's important is because many of you believe in using rocker bottom shoes. Many of you believe in flat shoes, whatever. So this is an adjustable strap that you can just pop up and put it in a different hole. And then it goes to where you want it to go to fit the bottom of the shoe. So that's what TayCo External Ankle Brace is. Where did it get started? When I was at University of Notre Dame, we treated many ankle and hindfoot injuries. When I retired at age 70, Notre Dame asked me to look into this brace that a trainer had invented. A trainer came out with the idea that obviously necessity is the mother of invention. He got tired of Lou Holtz and Brian Kelly and all other coaches yelling at him why he couldn't get a grade 3 sprain back in the game. So he invents this external ankle brace. I looked at it and of course the light bulb went on. It's like the inventor of the wheel. Why didn't I think of this? So I took it to the engineering department and I took it to the business department and we then put out the product. And now we started in the athletic field about 3.5 years ago. And now we have 20 NFL teams that use it. We've got 70 NCAA teams. Alabama has 40 of them. We put it in over 13,000 people. And the reason you don't see it on Saturday and Sunday, and they all play with it, of course, the full range of motion TayCo, is because we spat it or tape it over. So you can't see the TayCo. But I'm going to give you an example of the TayCo on a football player from Florida State. I got called on about 2 years ago. And he had a grade 3 sprain on Friday afternoon, and he wasn't going to play against Alabama. Okay, he could hardly walk on it. So I said, he'll play. I sent him down to TayCo overnight. We spatted it or taped it on. And here he is the next night throwing this Alabama player in the air about 10 yards, as you can see. Now, he got a 15-yard penalty, so I'm not sure it's worth it. But you can see the TayCo spattered on that right ankle right there. So now, what is about TayCo? And I'll go into the patient and the work comp market in just a second. TayCo is a lightweight, functional alternative to the walking boot. It's 15 ounces versus 2 to 4 pounds. It has exceptional ankle and hindfoot stability and comfort. We've done studies by the head of biomechanics at Notre Dame, and basically it's a stable in inversion and even better than inversion than a walking boot. It also fits over the patient's own shoe or work boot, which is very important because you use the patient's own orthotic then. And if you use the patient's own orthotic, that can be the corrective device and TayCo's the stability device. And in my mind, the vast majority of people need an orthotic. And also it's PDAC validated for both our acute brace, which is meant for a condition under 6 months, such as a sprain, fracture, tendonitis, or the custom brace, which is meant for a condition 6 months or more. That's not going to last less than 6 months. It's also PDAC validated for the custom brace, which applies to a condition that's going to last more than 6 months, such as Charcot, rheumatoid arthritis, chronic PTDD, and those other diagnoses. Now, there's 10 cogent reasons why I believe TayCo External will replace 80% of all CAM walking boots, and it'll replace 80% of all internal AFOs, because you constantly have to adjust those because the foot collapses more each time or the ankle collapses, and they're uncomfortable. And if you're a diabetic, you can run into problems. So that's what I have the 80% rule. We have much better patient satisfaction, one. I've never met a patient that thanked me for putting them in a walking boot. Secondly, it works with your own orthotics. Thirdly, it has 3 hinge options, as we pointed out. 4, and very importantly, it's OSHA work shoe compliant. In other words, you can't go back to work with a walking boot because it's open-toed. Well, you put the TayCo over a work boot or a shoe, a diabetic shoe or a jogging shoe or a walking shoe. If they lay carpet and all that, they don't need a steel toe. So you return them to work much quicker. That's really important if you do any work comping. There's more margin financially with ours than versus a CAM walking boot. It's more functional. We can return people to function 3 to 4 times quicker than a walking boot, because in a walking boot, you also decondition. You sit there and watch The Price is Right, if you're old like me, and you don't do anything. And so your muscle and neurological systems both deteriorate. Something very important is consistent leg length. The boot throws your hip, back, and knee off. 65% of people complain of back, hip, or knee problem after 2 weeks in a walking boot. 30% of people complain of hip, back, and knee problems 2 months after they've had the walking boot off. So this is a tremendous price to pay for the patient and society. 8, we're much more comfortable. Nothing's more comfortable than your own shoe. 9, we're more compliant. Only 30% of people are completely compliant with a walking boot. They take it off to drive, they take it off to sleep because it torques your hip out. And it's lighter weight, as I pointed out, it's 15 ounces versus 2 to 4 pounds. So what are the 3 targeted users for TayCo? Well, number 1 is just regular patients with ankle or hindfoot diagnosis. We're a proximal midfoot brace. We're a base of the 5th metatarsal brace, but we're not a metatarsal or forefoot brace for bunions or anything like that. Now, there's people that really benefit from this. There's anyone from age 16 to age 106. So you can be a generation X, Y, Z, or a baby boomer and benefit from TayCo. But especially the elderly people, because when you think of, like I said before, sitting in a CAM walker for 6 to 8 weeks and you don't do anything, you decondition. And then 2 months later, after you take the CAM walker off, you fall because of stability problems and balance problems and weakness, and you break another bone. You end up breaking a hip. And I've seen this happen many times. So this avoids all that because you can be active. Secondly, the OC Health work comp is very important because everybody wins. The company needs their patients back to work, not only because they're workers, but also because of OSHA. OSHA has something called days lost. And if you have too many days lost, OSHA fines you. So no company wants that to happen. And the caseworker is in charge of choosing the physician group for that company, who are all becoming self-insured. And that company and the caseworker base their analysis of a medical group on evidence-based medicine and when they return them to work. So you'll have to be in the upper quartile of occupational disability guidelines to get any business anymore. So if you hold a sprained ankle out of work for 3 weeks, you'll never see another patient from them. So I would think you'd want to get a sprained ankle, even a grade 3, back to work within a week. with the TayCo, okay? And most of all, the physician wins because work comp pays very well and pays very quickly, but most of all, the patient wins because they only get 2/3 of their salary when they're off work, but they get 100% of their salary whether they're back to work limited duty or regular duty. And then the last group of patients is cleated athletes, football, as I showed you before, lacrosse, baseball, et cetera. You can rehab basketball players, but you can't play with this because it prevents supination, pronation, whereas you don't need those in cleated sports because you plant and push off. So this is a TayCo testimonial. I just want to play for a minute and on a 91-year-old, very satisfied patient of mine.
Well, the injury happened when I fell in my condo. And I'm a stubborn guy. And so I said, oh, I can get up. And so I struggled for 35 minutes, finally got up. Then I went to see the doctor, and he said, oh boy, you've ruptured your Achilles. He said, I'm going to put you in a boot. It handicapped me. It was so burdensome, and I had trouble putting it together every day. I'd spend an hour and a half getting it back together in the morning. I'm very frustrated with it, really. It was big, it was bulk, and it's heavy. And I just didn't have much movement in it. Then I heard of this TayCo. When I got that, it was 100% easier to put on than the boot. I've been wearing my TayCo for 6 to 7 weeks, and it's a wonderful, wonderful product. My mobility is back, really. I just can't say enough for TayCo. It's changed my life, really.
Now, what are the indications? TayCo external applies to every single ICD-10 in the ankle and the hind foot. There's 200 and some. So, but the most common uses would be for sprains on the left-hand column, where you use the acute TayCo because it's under 6 months of use, or fractures, whether displaced or non-displaced, whether you fix them or not. For tendinoses, on the custom side, you'd use it for osteo, you'd use it for chronic PTTD, which works great. I use mine for golf because I've had surgeries for chronic PTTD. I've used it for Charcot. There's so many indications for this that, as you see in the right-hand column, use it for total ankle, use it for base of the fifth metatarsal fractures, not a Jones, but 90% of them. You can use it for gait and balance problems. I've got patients with MS, so it's a stability and a balance brace. Now, we've got a number of research studies going on by very sophisticated biomechanical labs. We don't have to go through this, but the Notre Dame study shows we're as effective as a Cam Walker and as a cast after 1 week because they get loose in inversion and eversion. We've done gait lab studies. We've done all kinds of balance and stability tests. These are all done with very sophisticated laboratory instruments. It's PDAC validated for both our custom brace and our acute brace. And the reimbursement is very good. If you look at Arizona, California, Nevada, your margin is $257. The price is $225 for a single TayCo. We have bulk discounts, obviously, all the way down. So your margin is $257. It's $770 on the custom. And in, let's say, Florida and Georgia, Alabama, it's $272 on the acute margin, and the margin is $796 for the custom. How you order them, we come in 8 different SKUs. We come in small, medium, large, extra large left, small, medium, extra large right. We obviously couldn't make a universal TayCo because we're an anatomical brace, okay? Our malleoli are anatomic. The medial malleolus is higher than the lateral malleolus, just like it is in every human being. And also it's forward and then the lateral malleolus. So it's an anatomic brace. So on ordering it, you see up here, you order according to shoe size. Medium and large are the most common sizes we have. So in summary, TayCo is a better brace for your patients, and it creates more margin for your practice because one patient tells another. We all get our referrals from different patients, and by satisfying the patient, you'll get more referrals and you'll get more patients. So that is the summary of the TayCo external ankle brace. I welcome any discussion or any call, day or night. I'm available 24/7. I really think this is going to change the world functionally. So my cell is 574-286-2273. So if we can talk about any clinical situation or any financial situation, I'd be glad to relay that, whether it be Charcot all the way to same and similar. Okay? Thanks very much for listening, folks.